I'm sorry, Dr. Shripriya, I don't understand what you saw on the net. Uh, what is the number you have shared? Doctor, can we start the session? You ready? Yeah, okay. Okay. I should start recording. Yeah. Good evening, everyone. Good evening, everyone. Thank you so much for joining us today. Let me not further waste time. I would directly give the panel to Dr. Rajesh and he will start with the session for us today. Thank you so much for joining. Yes, Doctor, you can start with the session.
So, welcome all, and today's topic is the difficulties that are faced by practitioners in converting the symptoms of the patients to that of the repertory. So that's what we're going to take up, and
Doctor, do you have a slide to share? I've given access for the screen sharing.
I'll share.
Yeah.
So that was like just start with some sort of interaction.
Yes. Now I've just given the access so that you can, so that I don't interrupt in between your introduction. That's why.
I saw them.
Okay. And
Like, introduce yourself. We don't know about you, not much. So you can introduce yourself.
I am Dr. Ashmika. I have finished my BHMS in Pune, Bharatiya Vidyapeeth. It's been just 2 years, so I'm a new, fresh graduate. I came into homeopathy. I used to take homeopathy as a child, and that is how I fell in love with the pathy, and that is how I wanted to pursue the whole medicine, and that is the main reason that I came into homeopathy, and I fell in love with homeopathy more and more every day I practice.
Nice. So, do you have any views regarding the topic itself?
Repertory, definitely, yes. It has always been a very difficult subject. I'm not saying it's going to be very easy on the first day or anything. I love repertorization. In fact, during my college days, all my classmates used to give, the case for me to repertorize on the software. I used to love doing that. But over a period of time, I think it became difficult. As the dealing cases became difficult, repertorization also became very difficult. So I am also in this session to learn and understand, making every patient language to rubrics. It's very it's something which every homeopath has to know, because materia medica. Doctor, are you frozen? Doctor, can you hear me? Just give a few minutes. Doctor, I think his network is a little. Um,
Can you hear me? No.
yeah. Now we can hear you, doctor. I think there was a little small network error. It,
Yeah.
yeah.
Actually, I didn't hear what you said. Yeah.
Yeah, so
That's
it is.
okay.
Yeah, I am also in here to learn the session. It's very. I am also like. It's been like 2 years that I did never opened my repertorization, because after my graduation, I completely got into materia medica, and I wanted to learn more on materia medica and make my materia medica knowledge more stronger. for my practice than my repertory, but now I feel that I should have given equal importance to repertory as well as materia medica. And
You can start sharing your screen and
yes,
go ahead.
yes, doctor, it's already started. You can start.
So, welcome to today's webinar. This is what many people say, converting the patient language to that of the repertorial language is a difficulty that we face quite often. So let us look into it. Before going to before going into the details, these are these are the masters who has uh, who has started the practice of repertorization. It was first Hahnemann, and then Bonninghausen made it a little elaborate, and then Boger worked on it. We all know about Ken's contribution, and it is one of the most used repertories. And then Nair is someone who actually took every symptom from the herring symptom, which is a pure materia medica, and tried to convert it to that of the repertorial language or into the rubrics. But for many, it is like hard to practice. Clark, Borick, both William Borick and Oscar Borick, their contributions to us mostly to that of the clinical material because these people started using. Of course, Boger started it, but then after that, Clark and Borick were those people who started mentioning the names of the disease or the pathological condition as such, and went ahead with it. And then we have Pirate Schmidt, who worked upon Kent's works and then had been a great contribution to that of the repertory. So, to be successful, we should be able to do what those unsuccessful people are not willing to do. And we should not be wishing that things should be easier, but hope that we are better. So, that is to say, we should not be laid back or lazy, and then hard work has no other replacement. I asked few of them like what are the difficulties that we face, so on and so forth. Some of them they said that we are not at all familiar with the repertory itself, although people have worked out their cases during their final year and even during their internship, but they are not that familiar with that of the construction of the repertory or repertory in itself, what to use, why to use, nothing as such. It's like always confusing. That's what they said. Material medica is something, and repertory is something that is not that palatable, and it is time consuming. All those things have been mentioned. So that's it. But then, how do we go about it? Like we all do it. Probably we don't do it also. The thing is, we'll have to get into the details of a repertory or any book for that matter. Before starting, we'll have to check with the preface and the introduction of that of any repertory for that matter. This is the one that I'm showing you is the introduction of Boger Bonninghausen's repertory. And you can see there is a detailed plan of construction given. The philosophical background is there and what are all the things that have been used. Boger's work on Bonninghausen's characteristic repertory is based on the following fundamentals. Those things are enlisted. So basically Hahnemann has emphasized in his teachings on that first take the complaints of the patient without interrupting them, write it down in their own language, and then also don't forget that he has mentioned that complete those symptoms, carefully re-examine those symptoms and try to confirm those symptoms and confirm the symptoms. So same way, the concept of Bonninghausen's totality or Boger's totality is also that of confirming the symptoms, making it a complete symptom. That's why first thing is the doctrine of complete symptom. So I don't think so. I need to mention to everyone what is the complete symptoms definition as per Bonington or as per Kent. There's location, sensation, modality, concomitant, and site, time, extension, and modality. Then there are the pathological generals and all in this book. So I don't want to bore you with all those headings. But the point is, before getting into any repertory, you will have to understand the plan and construction of it. In fact, grading system, what grading system is used, and all those things. Then comes Kent's repertory, quite popular. Even in Kent's repertory, we have like there is this section, use of repertory. Why should we use the repertory? How to study a repertory? How to use the repertory by J.T. Kent. And there is a practical part to it. Repertorizing cases are being given by Margaret Taylor and John Weir. So each one has a different set of philosophical background. So to understand it, it is good to read those introduction and preface, introductory notes, plan, construction, contents of it, all those things. There is a huge gap between the colleges, be it in India or outside India. Like what people usually use is these conventional, traditional repertories, and when they come out, it's not that useful, or doing it manually is not that helpful. Of course, in our college, we are set to repertorize. Usually, we give it to the juniors, and they fill it for us, and we do it. Nobody actually pays a lot of attention towards it because it's a pain. Even I did it probably. In fact, I left the one single question wherein some of the symptoms are given and asked to convert it into rubric. I attempted all those questions and I left it. That's how it is in the college as such. But when we come out, it's practically impossible to sit and manually repertorize any case for that matter. So in this era of technology, what we do is we use different softwares. And in the softwares, we do have all these repertories, but again, there is a confusion which repertory to use when some people they mix 2-3 repertories together and make a repertorization out of it. Like Bonington's concept of construction, his construction of BBCR or Bonington's characteristics is different from that of uh, Kent. But how can anybody use it at a time together? So, which is like a little bit of an ambiguity. And then some feel that it is incomplete, no repertory is complete, they lack these symptoms and all those things. So today we are going to discuss the last one, the language as such. Language seems to be very difficult and don't know how to go about it. It is what many people say. Like it is all the patient says something, the material medical says something, and repertory has something else. The point is, materia medica has a certain terminology written in a particular period of time. It is quite elaborative, it is quite distinctive. But then, when it comes to repertory, we need to put it in a particular format or in a particular language wherein words are common, and then go into different sections. So sub rubrics are basically going into further details. So that's the difficulty that many face. Dr. Rashmika, there is something. Are the people asking something, or is there any difficulty?
No, doctor. They just wanted the YouTube or the Facebook live link. We don't have a YouTube live. We have a Facebook live which is going on. So they just wanted that link. Sorry, doctor, for disturbing.
Yeah. It's on I Love Homeopathy page on Facebook.
Yes, on Facebook. I have given the link on the chat section. You can
Yeah.
join from that. Yeah, thank you.
So usually people have like even the patient says and doctor searches for nose block. People say nose has blocked, sir, naak band ho gaya, naak all those things. And if you look at it, there is nothing like if someone has to search for nose block, it is not present. Where is it present? Again, you will have to see the cross reference to it, obstruction, stop sensation. And then if you understand this aspect, this is a simple aspect, like obstruction is more convenient to be used all over the repertoire rather than using a blocked sensation. And blockage is, of course, complete stoppage and all. Like it doesn't fit into the terminology. So we have given the word obstruction, and then again there is a synonym to it, like stopped sensation is also there. So if you get that, you can also see there are several sub-rubrics. And if you also can see, first there is alternating states, alternating with discharge, alternating with dryness, alternating with pain, and then alternating sites are there. So it is first alternating, and then alternating sites, and then you directly go into the sites. And then you can see further into times of the day, time modality. For example, here, last one is daytime in this slide. So that's how you look into the main one and then the subs. Even acidity is something that many patients use. Patients directly comes and says that, sir, acidity, I have acidity. And there is no use in directly going and searching for acidity because it's a broad terminology. But when you ask your patients, what happens is that it is either sour erectation or heartburn or pain in the pit of the stomach or vomiting as such. And then, so you'll have to either look into erectations or you'll have to look into heartburn. The funny thing is that some people, mostly even educated or uneducated, they just use acidity for several things. Sir, acidic, acidic ho gaya, acidic आइड acidic in the dinner. But when you ask them, some people, they are very shy to say that they're constipated. And then they say these words, gastric, I have gastric. What is that gastric? If you ask, they say that actually I don't go to school properly. That's what I want to mention. And then some of them, they refer it to that of indigestion. And some people, as indigestion in the sense, the food stays for longer in the stomach and then it doesn't come out or there is distension. Even some people mistake it for distension. They don't say that it is gas. Or gas is a common terminology that people use, right? When they say that we have gas in the stomach or something. But they just use the word gastric or acidity. So you'll have to ask and confirm and then look into the repertory for the details as such. So this is that. And then there are certain words that are quite confusing. Like if you can see, sputum is what the patient says, or patient says in his local language, like balgam, cough in Hindi or in Tamil, yechil varadu, chali varadu. That's what they say, or in Telugu, kapham vastadi. But there is a small confusion over here, and not especially even doctors get confused. Is like there is the cough of Sanskrit or Hindi or that of Ayurveda is the expectoration or the phlegm. The right word can be balgam, but many people use the word cough also. But they also confuse it with the word cough, which is khasi. So that sometimes happens with that of the language variations. Many a times happen in Maharashtra, Gujarat, even in certain parts of North, wherein people confuse it to both. Like even patients say that, even here, so those people who are accustomed to the word kabam, kafam, or cough, they say that they mix it with cough. Even some people, like for nausea, uh, they use the word vomiting itself. So these are the misnomers. So you will have to look into it. So expectoration is where you have to see for sputum rather than typing for sputum. If you open repertory and if you type sputum, you won't get too much of anything into the repertory. It is under the expectoration. And then there is a dry cough. There is also wet cough that we use in regular terminology. But there, you won't get wet cough. You will have to see cough with expectoration, color of it, consistency of it, time modality, all those of it. And you have a direct section for it. And that's how we'll have to see. And This is to mention what the problems that arises are also because of the language that we use, the language that is our own understanding about a language or the same is synonymously used for something else. Same way, bedwetting is one thing. Like bedwetting is what we would expect to see, but there is no bedwetting in repertory. What you have to see is involuntary urination or incontinence in the bed. So I would like to mention this thing. Like you might have, I of course I would mention for myself. Like I have read several books, have given exams, we all pass, and have studied several teachers. No doubt, they are all very great, but the greatest teacher is the patient. Patient guides us towards to guides us towards the remedy. Patient is the one who teaches us because he can give it in a vague way, or he can give it in a very detailed way, or she can give it in a very detailed way, or in a vague way. It is our duty to find out, and that is the task that we are given. So, who is the best teacher? It's always the patient. And many people are familiar with materia medica, they say. Even I was familiar. I read only one materia medica probably all through my graduation. And then what happened is that I started reading other materia medica. And slowly everything started to be very vague, confusing, because no two authors wrote materia medica in the same way. Only some of the points are common. So how do I actually remember any drug is actually through the cases that I have seen. So what is the best materia medica? If one has to say the best materia medica is the materia medica of you yourself, we ourselves. Like we have, give me a second, I'll be back in a second. Sorry for the interruption. So it's the patient who guides us. We remember drugs through the cases. I saw this case of fever, so I remember these were the modalities, these were the complaints, and this was the drug given. So when you have given the same drug for 50 times, and there are some of the cases which stand out, and you obviously remember what is that drug and how that is how one actually remembers materia medica or the drug picture uh, in their life. It's not the what to say materia medica itself. So those were some of the examples of difficult things or common terminology that one can misunderstand, and also the language variations that could put in difficulty in understanding or searching. So here are some of the questions that were asked by some of the people. I actually has put up. Do you have any questions regarding this? You can give some examples so that I can show it. But not when it came out. So I usually receive messages to work out and send it like what would be the rubric. So this one is like person has asked like coughing every time and putting hands in the water. That was the question. No, putting water we don't voluntarily put it, right? We either try touch, we either go touch the water for washing ourselves or washing the ignorance. So logically, where it would be present is bathing or working with water aggravation. So here, cough in general, and then general is bathing, washing, aggravation has to be because there are only fewer remedies in the direct rubric where cough, bathing, washing, aggravation is there. So someone has asked like whether it's cold water or warm water. So you have different set of rubrics for that also. Like you can see below that cold aggravation is there, uh, cold water aggravation is there, and then you can see standing in water, that is in much longer, standing in cold water It's again in maximum state, sorry. So this is how we look into this one. This is one more example. And then there is another question: lymph nodes, where do we see swelling of the lymph nodes in the axilla and in the inguinal region? So it's quite easy. Just type swelling lymph. What the mistake that we do here is we type lymph node rather than typing lymphatic tissue, because we don't. But that is how it is there in the repertoire. So how do you do it? Like, you can type half of the word. You don't need to type the entire word. You can just type half of the word and you get where it is and how to do. So inguinal region is present in abdomen. Axilla is part of chest. That's where you look into the rubric spread. And then we are often touched by some of the symptoms like, oh, this is very peculiar, but all peculiarities might not be present as it is even in materia medica or in the repertory. So how do we go about it? It's like, here the question is left renal colic aggravated after eating. So renal colic, if you search in repertory, will not be there. What would be there is kidney colic. You can search in kidney, but not writing per se renal colic. Renal colic is what is written. So the only thing that you have to see is kidney pain, and the nature of the pain is colicky or cramping breathing. So those are the things that you have to take. And then since it is in the abdomen, you should also consider the pain, cramping, gripping pain in abdomen, eating after. Eating after is the modality, and there is a side to it that is on the left side, and the nature or the phenomenon is cramping, gripping pain or colicky pain. So this is like a sort of a complete symptom, but it will not be directly present. So you will have to take multiple rubrics to make it as one. Like, you can directly take kidney pain, colic left, but how many remedies are there if you see? There are only two. One being berberis, other would be something else. So to widen the scope of the indicated remedy, we usually take a generalized rubric, go into a section a little above of it, and also synonymous ones. Then we either cross and combine the rubric so that we make a complete symptom out of it. Because what happens sometimes is when only two remedies are present, I cannot see my question, but the question is stomach pain, left side, urination aggravation, lying on the right side, amelioration, and heat amelioration. It's a very discrete question someone has asked. So how would you go about it? First, you will have to divide this symptom into pieces. So where is the pain? The pain is in the stomach. And what is the side? It is on the left side. When is the aggravation? It is during, while passing urination or while passing urine. So first take that one, stomach pain. Generality is left. You can even take stomach left, but that would not be present. The stomach is on the left side already. So you won't have the side of it. And then urination, urine. You won't probably directly able to find all these together. So what you do is you split it up. Then I have taken stomach pain left, but it is towards the side, not the stomach itself. So that again is a little ambiguous. So you will have to consider the organ as a whole for that matter. In the stomach pain, heat amelioration is there. There are 10 remedies, and also there is stomach urination urine. But the best way to do is also taking the general rubric as such, and then doing it. So that's how we do it. And then here, Stomach pain, heat amelioration is there. But if you go to generalities, it may not be heat, but it would be warm. So here is some one more question that is written in Tamil. Like ரொம்ப நேரம் கை move பண்ணாம முடியாது. Like when someone is writing for a long period of time, and then they feel it like it is immobile, and then there is sort of numbness. So that is what it has been said. So what would you do is direct search for one direct rubric is like hand numbness of the hands writing aggravation. But there are only two remedies, zinc and agaricus. So again, we can use the possibility of using the building blocks, that is divide the symptom, complete symptom into small pieces, and again reconstruct. So we take extremities, numbness and insensibility, and then again the writing aggravation of the upper limbs, and then we cross it because it covers both of the symptoms. And when it is covering both of the symptoms, we can actually make divide it and make it into further more feasible for us to look at the other things. For example, Merck iode flavum is also covering all those symptoms. The same way you can say lycopodium is also covering those symptoms. That's how you do it. Break it down and then again put it. So one has to understand the components of the symptom, and then you can break it, you can make it. That's how you do it. So there is one more question, like पैरों से तंड ऊपर की तरफ चढ़ती है. So the answer to it is coldness extending upward. Coldness of it extending upward is where you will look. I can show you. So you see here chillness, coldness extending upward. So the question here is पैरों से तंड ऊपर की तरफ चढ़ती है. So the coldness is extending upwards. That is the symptom. You have 62 remedies. And then you have सीधे पैर में झंझनाहट होती है जो चलने के नीचे से ऊपर जाती है और फिर कमर में दर्द होता है एक साइड. So like it's a complex symptom. It has several variables to it. सीधे पैर, I think that is meant to be right leg. So झंझनाहट is probably electric shock pain. So if you can see here, some of the rubrics are present, but then they are very small, very vague. You don't have right lower limbs, and you don't have right leg also probably. And like upper limb is there, only upper limb and all this. So how would you construct it? So I'll do it for you. Pain, electric shock like. So you take this one, electric shock as one, and then you take lower lens. Of course, they mentioned right, so you can also consider. So we have constructed a part of it. Then what is written is that चलने पे नीचे से ऊपर जाती है और फिर कमर में दर्द होता है एक साइड. So there is another variable to this, like electric shock, like pain walking while. We'll see if it is present. It's not there. So what will you do? We'll do this one. There is pain lower limbs walking activation. And then person has also said that ऊपर की तरफ चढ़ती है. So the pain is radiating. We cannot find word radiating, but we can find the word extending. So you can see here, pain extending upwards. So pain extending upwards there. And then there is pain in the hip. Probably sciatica pain, but that happens in the reverse. Like usually the pain travels from the hip to the top, it passes through the course of the sciatica. What happens here is in the reverse way. That's probably the problem lies with the somewhere compression is also present in the feet or in the other limbs. So any hips, or you can directly go for lumbar reach. But remember, whenever they say that hip, there is a lot of discrimination. Hip, usually on the anterior aspect of the body, the iliac crest is present. That is considered hip, and the sides of it is considered as hip. For rest of the references, it is considered as the back lumbar region. So you can take back and lumbar region. Then you see now, you have a set of rubrics and you have a set of remedies. You can see the grades of it, how many of them has covered it. Like everything is covered by these first few remedies. Prophetis, capsicum, agaricus, anacardium, veratrum, sabina, diasporia, so it forms a nice mentality. When you have a large rubric like 713, 165, and 323 and all, you can directly cross them if you want to be more precise and to be more clear. Some people like eliminating Syndra. How that can be done is like you can go for a filter, restrict the remedies. You will get only those remedies you can see. So only these, that is 38 remedies are given. In that you can see which one covers more and which one is more similar. You can take the other symptoms that are present and you can see which one matches up, and then you can go over it. So why did I do it in the sense? The purpose of doing it is like you have only 17 remedies here. If I restrict to only those 17 remedies, there are some new remedies, there are some old remedies, but when I see the overall picture is covering something like that of Melaleuca or uh, some other remedy, and I just want to confirm if it is covering all those things. In fact, hydrogen covers all these things. So if you can see, hydrogen here is covering all the symptoms except that of this small. So even 5 is a potential one. And if the modalities, generalities, mental symptoms matches with that of 5, we can obviously go for it, not just these 17 remedies in it, because this, like if it, one can say, isn't it prominent symptom? But then we don't know. We will only know when we have a case, right? So that's how we do it. And it's always the totality that determines it. So this is one. And I have a case that I would like to present just for the sake of just a sample sort of thing, like wherein uh, how to convert the patient language into that of the repertorial language. That's the topic, right? So without a case or just for some of the questions, which is part of it, only partial, how would it even help? So we'll see one case for that matter, so that it can be helpful for us. So this is a girl, 13-year-old girl, and she had adenoids, and that's the main complaint. And she had been taking her family in the family mismanagement. Mother is has recovered from that of cancer. She had uterine carcinoma. She had been treated for that a couple of years ago, or maybe 1.5 years ago, and then uh, she got better. That's how her entire family started taking this. And, they are not in this city; they live in Hyderabad. So most of the conversation takes place through the telephonic conversations or through video call. So her husband is also a patient. He's a diabetic patient, and because he's young, he's thin, not obese like other diabetic patients, but his sugar is always uncontrolled, high. So this girl happens to be first one of them, and both the parents they work. So that is the just a prelude to what her complaint. She has adenoids, and then she has difficulty in swallowing. That's one thing. And then her father always used to say that she always gets this fever for even for the slightest change of weather, she would get fever. Or is it, every day she would have a fever. That's what he said. And then recently they again had wanted to consult me. When they consulted, the girl was telling some vague complaints, like she was giving out like, "What is your complaint? This is like this. This is like this. Probably this is because I have this complaint. So that might be like this. So I don't have water. So maybe my nutrition is not proper. I don't eat proper. That's why I'm not passing this. I don't know why this was the way she was answering. Like despite asking a lot, she was confusing me and she was not even giving any details. So what I did is you do one thing. I'll first speak to your parents, and then this time what to do is you write your complaints. That's what I said. What happened in the first time was like she was giving vague complaints. I said that it is not helping. We'll see later on. I kept the phone off because I had other appointments. I said that I will call him and write. I was thinking what else would be the best way to do it. So again, I called up. I spoke to the father first, and then the mother, and asked them to ask and explain. But they were like, "You only ask them." So I first took the case from parents, and the rest is like the girl. I asked the girl to write what are your complaints? What do you feel? What is happening? You just mention in whichever way possible. Write it and send it to me on WhatsApp. That's what I said. So before going to what she said, this is the case. Like father said that her father said that the child has she's 13-year-old and menarche was attained 1 year back. So her father says that she has mood swings, sad, feels sad and always dull, weeps for everything. She says that I'm anxious about you. Her ambition was to become a Navy person, work in the Navy. That is her ambition. That is what she is looking forward for, and that is what she has been telling all the way. Now that she says that, what will happen to you if I do something wrong, or like if something happens to you, I won't be here to look after you. That's what she said. This, and then my actual complaint is like, her father mentioned adenoids are there, the tonsils are swollen, fever with every change of weather, running is there, and the body is always warm. That is what he said. And he said that because of this, sometimes it is difficult for breathing, difficult for her to take breathing. And then these children, she has a younger sister. He said that they both fight a lot. That is one thing. And she gets angry for even for the smallest things. And she thinks that we are all blaming. That's what her father said. So with her mother, I had little history to take. So she was like, how was the menstruation going on and all? Menstrual history is like it is 21-day cycle. And the flow is for 7 days, which is very heavy and painful. And then there is leukorrhea between menstruation. Once the menstruation stops, after 6 to 7 days, there is profuse leukorrhea in water leukorrhea. But it is profuse, that's what mother said. And then she doesn't like to take food, she doesn't eat much. Bowel movements are always constipated. That's what she said. And her mother added that always during her childhood, she wouldn't go for toilet. She had some sort of resistance to pass school. She would even pass school once in 15 days. She would hold it back to go once in a week or once in 15 days. That's what she said. And then now it is like she goes for vowels once in 2 days. And then the other thing is like she's very lazy. That's what the mother said, and always wants to lie down and always asking for chocolates and sweets. And then one more thing is that lastly, her father added that my child, whenever she leaves, she even starts getting hiccups. This is a very vague sort of information. Does anybody think the case is complete? I didn't think so. If I go about it and if I have to replicate this case, the remedy might not be the same one that I'm looking forward for. So it is always good to speak to the patient, right? So this is what she wrote. So this is in her own handwriting. She wrote it that day evening, and this is what she has written. I can read it out, or people, if you want to read by yourself, you can read. But see that she is very careful, and she has written things in detail. She first introduced herself, and then she said that my problem, I hope my handwriting is clear and be able to understand. Like she is careful enough, and the first thing to mention is that, like, it is sort of what I hope so. You can read it. When her handwriting is so good, she doesn't even need to ask it. But anyhow, she asked for it. And then the second thing she wrote is, I am very lazy, such that I am lazy to catch the mobile for hours during online classes. And then the other problem that she has mentioned is problem with my family. My mom, she always misunderstands me for everything. My father, he always says that he don't want me and my sister if you are not obedient. It hurts me very much. That's what she says then. Probably she also mentioned to her parents, but then I don't know how they understood that this is what this girl says. And then my sister. It is not mandatory, but she don't obey me, and she always talks to me very arrogant, reckless. Like she is not expecting her to be very obedient, call her Akka, Didi, and then be polite to her while speaking. But then she should be like not that rude or reckless. That's what she has mentioned. And the fourth point is that my granny, she always supports to my sibling. She don't need that whether my sister is wrong or right. The discrimination difference in the age makes me feel sorrow and depressed. And then grandfather, he always forces me to complete household tasks. So why is this in a hierarchy? Mother, she goes for a job. Father also goes for a job, and they are left with the grandparents while they go for the job. So this has been the routine for several years, and the grandmother and grandfather take care of them. She has an younger sister is like pampered by the grandparents. Grandmother is always towards her side. With that pampering, this girl also throws tantrums or being argumentative and all those things. And this is what happens with the elder elder sibling. And grandfather is making she's a good student, obviously, with the 13-year-old girl writing it so eloquently and so in such a detailed manner. You understand that she's obviously doing good in her studies, right? And she's a topper in the school. Even then, she's forced to do this household chores at her grandparents' home, which is near. So then what she writes, the above problems made by my family makes me depressed and cry. But the society, after listening my problems, thinking that I don't have a problem with my total family and I can't. So the surroundings, the people who are around them, what they say is like what to say. The society says that you are only probably wrong and your family members are right and that you are not adjustable. So again, she is being blamed by the surrounding people and the society. This problem is from my society and from. And then she comes to the physical complaints. This is internal problems in the body. It's very difficult to swallow the food through the throat. I at least sneeze 4 to 5 times per day, which the parents, both of them, forgot to mention. Always wish to eat spicy and junk food even during this pandemic situation, which was also not told by the parent. My body doesn't support me to do work. So she is like physically enervated or not physically that strong to do her work. My periods run at least 6 to 7 days. Second day is very horrible and painful day. I suffer a lot. After the completion of periods, 1 week white discharge starts and it is also continuous in 7 days. So that is exactly during the second half, after the menstrual cycle. The main problem is my constipation. I go to the nature call alternate days. My body's temperature is very high, such that if any other person has the same temperature, he might. So one might feel that I feel. And then again, what has happened? Like my conversation with her a few days ago, what has happened? That has been like mentioned here. She is like she wrote her gratitude, thank you, and then she writes, "Sir, I'm very sorry for the idiotic work, probably about the writing movie. The misunderstanding between me and you is only possible because of one. I can't get your point while speaking. It's not audible for me due to poor signal connection." She doesn't need to apologize. In fact, uh, for her age, she might have been blaming me. She never is blaming. And then even when I tell my weakness to you, my mom laughs and makes fun of me, and I lose my concentration. I'm unable to listen to what you say. So that is the disturbance over here. Like, what to say? If you have carefully read, she's not blaming anybody, like not even her father, mother, or anyone. She's explaining the problem. While they are doing so, she feels the pain. That's what it is, right? And she's like very careful and very considerate. Probably, you can say that she's wise, and she's like she looks quite pretty, although not very fair in comparison with this, but then very. So, how do we repertorize this case? So this is the repertorization of the case. So, like parents, they don't actually understand that they are blaming her or anything. And while after the case taking, when I spoke to the mother, I told her like, see, you cannot make your child feel like this. And when the society is saying that probably you are the one troublemaker, you are not adjustable, and that is why everyone is like complaining about you. One might get actually detached from the family, and if anyone who is an aggressor or anyone who is a exploiter can take good chances of it. Of course, it might be a friend, it might be a relative, it might be not this. Now that you just came to know, it's good. But how would you do that? While being mother says that she is very intelligent, she's this, she's that. She would say that I won't wear certain type of dress because father you don't like such dress and all. She's like that, sir. But the thing is, she overthinks. So I told her, madam, you have been, I know all these things. Like she was giving explanation why it's like we have to go to job. Madam, I know everything. What I am saying is different. Like why should she feel like she is being blamed? When she said that she overthinks, when a parent tells a child that she is overthinking, that again is blaming. That's what the child would feel, right? What a parent should say is like, you don't need to think that much. Everything will be fine. Is what a parent has to say. So that is some part, which is that is something that we should explain. And this girl obviously feels forsaken. That is why she has developed this anxiety about what would happen to her parents. Like not now, in future, because when she wants to join the defense academy or when she wants to join the what do you call it, the navy, uh, she has to travel or she has to be away, right? Then what would happen to you? Like that sort of insecurity is reflected in this. And then laziness is there, and she feels that she is misunderstood, and she's obviously emotionally little vulnerable, right? So actually, this is something that has to be chopped out with the family also. People should say that mother and father would obviously should say that we are working for you, and we obviously have to earn. That's why we leave you at your grandmother's place. But you don't need to take everything so seriously. We are just saying it. And father is saying that if you don't behave obediently, he's not obviously going to give. It's just this one. But the parent should also have taken care that it doesn't go beyond that. Right? So those are that is one thing that we as physician has to do. Also, don't forget that we as a homeopathic physician have a great scope being a family. And one more thing is that if you understand, you can present it to the patient as well as the patient's family to what things that you have to correct. While sitting, listening to whatever they say, uh, we should obviously give them certain options. We should obviously advise them what to do, what not to do. And this is probably why people come back to us, not just for the remedy. And one more thing is that we all homeopaths, we think like as though we are great psychiatrists, we touch everything. But without giving a closure, if you send someone, they would obviously feel grief. Like some might actually weep while saying, or some might get agitated. But then, if you are listening to this, you also have the responsibility to give a proper solution or things that might help you to go further and correct certain situations. Like there are obstacles to cure, right? Some of the physical things that one person might have constant exposure to particular things. These things that happen in family are also those exciting or maintaining causes. They should also be spoken out, told, explained the consequence of what could happen later. Like the other day, I had someone, she's 40 something, having two children, and she is weeping, saying that my father, he has beaten me when I was 5 years old. He asked me for a question, and I told the answer in some points, 5.0 point something. And the other boy told 5.0 something. My father gave me a slap to see how good he is. But what I did is I have written the same thing on paper, but for the convenience sake, I told it in a short form. But my father should not have done it. What she did, she's obviously elder now, she can forget it, but she has not forgotten it. And she has asked it to her father when he has come after losing his wife, and that is his mother. And this lady was like, even then, you did great injustice to me by beating me that time. I didn't deserve it. So This forsaken feeling can later on go into hatred or complete withdrawal from the society, or something like I had been met with great injustice. That is the level of intensity that progress. So, if you can think about it, you can actually work in a better way. So, I think I read the case, it was clear, and the girl has written in very clear cut manner. The remedy that was selected was healthy. And I hope so. You have understood while I was speaking. You should obviously most of you should have gone through the complaints that I have, complaints that has been converted into the rubrics. Here also, you can see that some people ask that Goni-Mossin's method. Where is it? How to do? We would like to do. This is also Goni-Mossin's method. If you actually carefully see, you have the personality of the person. You have some time modalities. You also have modality by circumstance. You have what to say, the concomitancy. So that's how we work out. And this is actually, we can divide it, but since I think I already took 15 minutes of you extra, I'll stop it here. Maybe we'll go for the question and answer session. Thank you everyone for patiently listening to me. I hope so. It was useful for everyone.
Yes, yes. Actually, to be honest, I was actually about to approach you because even in the clinic, I have the complete repertory which you
I can't hear
had.
you.
Can you hear me now?
Yeah.
Yeah, I was actually about to approach you because I had a few difficulties, working through the repertory which you had compiled,
Yeah.
the complete repertory, and now I have a few tips and tricks to access it now.
Okay. Good.
I do still have few more doubts, which I can, if I have the access to it, I will definitely ask you those questions. Um, what was the chosen remedy?
Calculator.
Calcarea cup. I was just reading the questions. There are a few questions.
Yeah.
The color indication, Anjali Sharma. Okay, Anjali Sharma. So, what was the color indications where? The highlighted color indications, Anjali, during the repertories. I didn't get.
I'll show you just a second.
Yes, yes. Orange, blue, green, and all.
Orange, blue, green, right there. Okay. I understand. The this is grading. Four marks. That is highest grade is always in blue, and orange is for 3 grades. 2 is green, and then
And it's black.
one is black. And if you go into the rubric itself, you can see here those ones with single mark or like this, and then the fourth grade remedies graphite is causticum and colocynth or in orange color. You can also look like this. This is order of preference, like within the rubric also each and every remedy has a ranking according to their occurrence in the related rubrics, and that's how it works. So you can toggle it and see this is in the alphabetical order, like when you see the repertory. And then you can also see this one. If you want to see which rubric is covering which remedy, you can go on click on that particular rubric. You can see what all it has covered. And also, if you want to see which remedy is covering what are these symptoms, you can go with this. There are other views to it also. So you can look at it like this. Go.
Yeah, that was another question. Why standard? Why or what? What is standard rubric, small rubric and all? Anjali Sharma. Yeah.
See, those are different modules. It has been in several softwares since long. Those are based on certain formulas that gives you an idea about this thing. Standard is standard fixed to that of the program. The programmer fixes it. And the small remedies is those remedies which may not be actually covering all those symptoms, but then uh, they are those potential remedies that could be indicative of this thing. Like if the one that I have been showing you here, graphitis is quite clear. You can see graphitis is on top all these places. So it is almost all clear. But when you are not clear cut, when the case is not clear cut, what happens is that one remedy would be graphitis here, and then here again some other remedy like diasporia, here something like berberis or something, or even cilicia or something, and then here lycopodium. Then you can obviously understand that your repertorization is not clear. And then also one more thing is that here you can see 100 is the score and here is 97. So it is very similar. Like they have almost covered both all the same symptoms, and causticum and graphitis have covered each and every symptom actually. All six rubrics that we have taken, even anacardium and agaricus they have taken. But the score difference is 82 and 100 between graphitis and that of the anacardium. So the gap is higher. So if your case is actually very clear, perfect to the totality, then what happens is this gap between the first and second remedy would be very large. So you can be clear in your remedy. So also that you can see in different modules which one is covering what, and then you can go with it. Simple counting is similar to what we actually do in the paper repertorization.
Paper repertory, pencil-based repertory.
Bonihausen's is like Bonihausen style, like the completeness of the symptom.
Complete symptom.
That is like, it's just a module. And actually, these have a formula, and that's how it works. One can access this formula here. So here, these are the standard formulas. One can also, if a person actually has an idea about how a repertory is constructed and all, you can go with your own formula. So here, I can show you what is it. Like in standard, what is these are the things parameters that are put in. Remedy grades are given moderate importance, and related rubrics like if you have electric shock like pain in the lower limbs, also you have electric shock like in the pain in the head, you have electric shock like pain in the abdomen, then it is related to this one. So like electric shock like pain is in the same remedy everywhere. So these are all interlinked within the repertory program as such, which doesn't happen with the traditional repertories like Kent or other things. So with that capability, this related rubrics can be given importance and greater importance or lesser importance. And then importance of the number of sources. Some people like, why, if it is already fourth grade, why do you want to add? But why we add is, one is proving, other one is from proving and confirmation or through cures. And the more number of clinical confirmations are there, the more it is added. So there are several grading criteria. One is based on provings and how number of provers, also upon the um, confirmations that we have. So number of sources is put towards the lesser side. It is not given a greater importance, but a lesser importance. And then small remedies is again there. Small rubrics is there. Like small rubric in other terms is a rubric that has less than 30 remedies is a small rubric. Small remedies are those remedies which have less than 500 symptoms in that particular related to that particular thing. So one can use weightage factors or they can remove it. There is also balancing of the symptoms. Balancing is like if opposite symptom is present, it would reduce the totality of it. And then polar rubrics are there, like polarity. I think people who are accustomed with boning us understand the polarity, the opposite thing present in the same drug, like being thirsty and thirstless. So those polarities can be taken. So that's one thing. Polar compensation one would like to make or not. So this is the formula based on which it is working out. In fact, there is one more thing. One can also see this, but it is based on someone else. There is this module also, if people would like to see. This is Brent Grantley's color coding. color coding according to the miasms or facial analysis. For that, one has to be acquainted with Brent Grantley's facial analysis, homeopathic facial analysis. But I don't usually use it. So there are also these possibilities, like why we should use repertory is also one question, right? Like some people would like to go and see about plants and kingdoms and families. One can look at it this way. So this is only animals. You can see sepia is the most indicated, and the lacus is Cocos cacti. One can search for only plants. The other possibility with this is also one can search for families as such. Like Liliaceae, one wants to see, they can see liliacs. And these are the remedies that belong to liliacs. Or what I usually do is like, if I want to compare a couple of remedies, I do it this way. We compare only 4 remedies or 5 remedies or whatever it is according to your this thing, and you can do it. This is polarity. Agaricus has this polarity, like walking aggravation is there, amelioration is also there, so you can safely discard agaricus for this case, and you can go. That's how it is. There are several other possibilities, but probably in some other center. Any other questions?
Yes, doctor. Rubric for watery coryza, like tap water, from 6 a.m. to 9 a.m. Time with time modality.
Coryza, usually people say running nose, cold and all. Coryza is fluent. That's what we would say. So coryza fluent, daytime. With the specific time modality, it would be present, but you can go for coryza only 6 a.m., right?
6 a.m. to 9 a.m.
So it is not actually present. But the best way to do is coryza fluent has to be taken and then go to generalities and then 6 to 9.
And then time modality. Okay.
So you have 6 a.m.
Morning 5 a.m. 6. 5 a.m. to 6
What they
a.m.
have asked for is this 6 a.m., 9 a.m.
Ah.
So you will have to cross both of these things. You find out.
Rubric for cough due to post-nasal drip by SV. Cough and
You can go with nose, coryza, post-nasal cone, and then you can take Keter also. You can do that way, or you have directly these remedies: Hydrastis, Opulus, Spigelia. That's it.
From Dr. Kasturi Rangan. Can you choose based on score or clinical correlation?
Like, for example, I didn't understand the question.
I think I don't know what she's trying to say, but I think if it's after repertorization based on the score, probably. Dr. Kasturi Rangan, can you please explain the question? I'll go for the next question till then. Those remedies cover more percentage in third row, 3 row, have to select. Dr. Archana, can you give a little clear question? I couldn't understand the question. Anjali Sharma again. Sir, if we get remedy on one symptom, then we need to move further when the other symptoms too complicated, kind of tough to repertorize.
What is that?
Anjali Sharma, do you mean by if you get one symptom and then if we get remedy on one symptom, then
You can
we need to move.
ask directly.
Yeah, okay, sure. Anjali, it's your second day that you're coming online for talking. Please come and talk. Anjali, I have given you access to. No, Anjali is not present.
Hello,
Oh, yeah. Yes, Anjali, tell me.
I'm so sorry, ma'am. I got disconnected.
It's okay, Anjali, it's okay. Tell me a question,
Sir,
Anjali.
yes, ma'am. I was asking कि if we get remedy on a symptom which the symptoms which patient is talking about is distracting towards like it is not giving a proper remedy, then should we repertorize on that? Like we should give remedy on that single symptom which is peculiar. Like
Yeah,
we get only single remedy with that.
अंजलि शर्मा जी, आप रेमेडी एक कोई एग्जांपल दे सकते हैं?
जैसे सर अभी मरमरिंग है ना पेशेंट के पास जाएंगे तो पेशेंट लाइक ओल्ड एज पेशेंट है लाइक ही मतलब वो पेशेंट के सब कुछ लाइक वो डॉक्टर से इंटरेक्ट नहीं कर रहा वो सिर्फ लाइक वो अपने धुन में लाइक शी इज जस्ट मरमरिंग एंड ऑल लाइक शी इज जस्ट मरमरिंग एंड ऑल तो अभी पेशेंट अभी कैंसर में ये ओनली सिम्टम है लाइक मरमरिंग का so we can prescribe on that.
Murmuring, like why is she murmuring? वो बात होता है ना. Is it because of weakness that she is not audible, or is it that she is not willing? या सबके साथ
No, no, she's not willing. She don't want to talk. Like she's just ignoring everything. Like सब अपने मर्जी से करना है.
not murmuring, right? Talk indisposed to, mood repulsive to talk, all those things come. And then I would like to say this one, but many people have these questions like, should we concentrate on mind or should we not? And there is lots of misinterpretation that can happen. But see, that is not how homeopathy works, right? Homeopathy works based on totality. Where you have consulted someone, like even it is old age, you have old age complaints. You can take old woman in, one old woman in, and then whatever presenting complaints are there, is it whether be it trembling or be it any age-related complaints or whatever it is. And also remember one thing: it is both easy for us as well as it is easy for us as well as for the patients to understand. Like a fever is something common, right? Everybody has a fever. Everybody gets fever, and there can be fever stages of fever if it is a compound fever like fever, heat, thirst, and perspiration. But that is not the only thing, right? Like when there is fever, someone would like fan, someone would may not like fan, someone might like slow air. And same way, someone is very thirsty, someone is not so thirsty, someone wants only ice water, someone wants warm water, someone wants little quantity, someone wants large quantities of water. And the same person is some people in same fever. Someone says that I don't want any light or sound, I'm sensitive to it. And someone says that play me some good music, hip hop sort of thing, or play me some soothing music, I want to listen to music. Someone else says that don't go away, keep talking to me, I need to you. Someone says that I want to sleep in your lap, don't speak, but I want to sleep in your lap. Someone says that don't come near me. So this is how we individualize the case, right? You, for a simple fever, be it a corona positive case or corona or any flu or normal fever, or be it any other compound fever or even coryza. But it is as simple as it is. Like if we think properly, that is how we individualize. And these are usually perceptible. If that is not possible, some of the clearer indices are like you have tongue. Every tongue is individual tongue is very unique and it has a different thing to it. So that way it is, tongue is good index to prescribe in usually the acute cases, even chronic cases for that matter. Pulse is one such thing. The appearance of the sclera, even teeth, how the teeth, whether they're scorbutic, whether there caries in it or not, all those things. So individualization is not that great a problem to see or to perceive. And I didn't want to sound harsh, that's why I did mention. But then the first slide I wrote if you want to be successful, you should not be doing what the unsuccessful people are doing. You should do something that the unsuccessful people are not doing. So that is hard work, and one has to actually work hard for it. I have a page on my name, if you can see. I have been doing repetition for almost 15 years, like not for myself also, but for others also. And on Facebook, I think since I have joined 2010 or 2011, earlier I had another profile, I think. So since then, I have been repetiting the cases of others, repetiting materia medica as such, and I'll show you. I used to select repetition of what's it? You see here, this is my page actually. I have posted several articles to it in it. And then we'll go a little further to see what has happened, what have been, how am I able to do it to this extent or like fast in the sense. It's obviously to practice. And if you can see here, this one is 2016, right? You can go back and see to this is some of the remedies and the rubrics have been mentioned, but if we still go further, I'll show you. Until it lose. The point that I would like to say is every day read some materia medica, but not just reading it. You also try to practice it by replicating it in repertory, because you already know the remedy and you know the symptoms, so you can obviously reverse search it, type the remedy name, and you can search for the symptom. It is not that difficult, especially with the software like this. And also try to work out the cases of others so that you can actually learn how a person approaches his case, but at the same time, you can check it in your own method and you can use it for your sake. So it's taking a while, but then there are lots of photographs. I think I had been too active on Facebook for a long while.
Doctor, she sent a clearer question. Can I read it out?
Yeah,
Meanwhile,
yeah.
yeah. Can we decide on software repertory score alone, or should you also correlate clinically based on patient's appearance, disposition, etc.?
Software is a tool, right? It's not something that is giving you an output directly. Whatever you feed into it, you put it. In fact, there are some softwares wherein you can make your own rubric, you can add your own remedies. And let us say I have added 100 symptoms, and then I have added some name to it, and I put it would come. So that is it. Like whatever you add is going to come, but what is already there in repertory, it is most of it is reliable information. And if you can reproduce whatever information you have on paper into the repertory, it is very helpful. The second thing is, what should I say? People should understand one thing, that we repertorize to check whether that remedy covers it or not. But the remedy is covering those symptoms that are presented by the patient or not. Usually, everyone says that Materia Medica is the final authority or whatever it is, but the confusion arises that whether this remedy or that remedy. So to check it, we repertorize. That's at least how I do. To check the remedy whether it is indicated, or if in doubt, to see the most indicated remedy. So it is a tool that we use for confirmation rather than a means.
It's always a bridge between the materia medica and the
So
case.
we have to like clinically, how would you see in the sense? Observation is one thing, but what you have observed is also present in the repertory. For example, the person is making like these sticks or something, tapping or making a sort of noise, like outing a face or something. Those things are given under gestures, right? You can put those things. A person can have fidgetity, physical fidgetity because of pain or something, or a person, he himself is restless mentally and all this. So if you observe those things, that can be right. And there are some of these based on appearance, in the sense oval face, this, that, and all are there. But those things are that you actually understand in your practice by seeing over a period of time. If in case that is reported in cases, that would reflect in repertory. Otherwise, it is not going to be there. But don't expect everything to be in repertory. At the same time, not everything is also there in material.
What is the rubric for straightforward person? Emariti Suresh.
For straightforward, let us search for straightforward itself. I don't think so. It might be there.
Why complete repertory, doctor?
Who has
Why not? No, that's my question. I'm sorry.
straightforward? We can see for assertive, but then again, it is like what to say. Uh, there could be ambiguity about several mental rubrics. But being straightforward is not a pathology, so that cannot be there. But straightforward, if someone is saying on face, it could be considered audacity. Audacity is like without without any discrimination. Just because I am right, I have the audacity to tell, or just because I think that I am right, I'm straightforward to say it. So that could be the possible thing. Audacity, like straightforward person can be straightforward for several reasons. In what way he is representing that straightforwardness, whether he is mildly or politely putting, that could be an attribute. Some people are like meddlesome. You can go for meddlesome. There is one remedy, calcarea pause, wherein a person usually tries to bridge the gap between two people. So he's like peace wants to be, and those things are there. But the people say upfront, like, look, this is what it is about. No? So audacity, not necessarily audacity always. We have to think a little further to see what straightforward is. Yeah.
Not one more question, doctor. I've not been able to find a rubric for spicy food or sweets makes feel disoriented and weak and light for a few minutes. Can you help, doctor?
What is the question? Like spicy and sweet food, everything. Spices.
Makes the person feel disoriented.
So spices aggravation in general is there. General it is go. You can select this one. Spicy condiments, piquant, highly seasoned things. And then take painting. Generality is painting is there. So combine, you can see what all are covered by both of them. And then can we take knife or straightforward? Knife is bolapan, that is what they say. One who doesn't. Knife person need not necessarily be straightforward. They just don't know. That's it.
In a case of acute case of delirium, chronic symptoms or recurrent symptoms occur simultaneously. Can we take at a time in repertorization?
Delirium is there. It is after the delirium or before the delirium. This is there. So that is what is alternating symptoms. They are more dynamic. They produce they show the dynamic aspect of the complaints, and those are very important. So that obviously has to become taken into consideration by repertorialization, both for acute as well as for chronic.
In our question answer section, people have asked, getting heated means.
Getting heated, for example, I'm sweating. If you can see, I have switched off the fan as such. So I'm heated up. That's why I have started sweating. So after sweating, what happens is you get cooled down. That is cold taking heated after. Other getting heated is like you are exposed to heat when you go out or when you're in front of a stove. So the heat, the warmth aggravating is a different thing, but you getting heated up. Like when in winter we go near the fire to heat ourselves. So after getting heated, that's what it is.
Person who is arbitrator, rubric.
Arbitrator means
Arbitrary, probably the person who's autocratic or something, like more of a dominant or a very cynical person, if you can take. Is that what you're coming to, Dr. Alpha Sukla? Alpha Sukla?
डॉक्टर अल्पा शुक्ला ऐसा है कि ये एक वर्ड में सब कुछ सिमटना इतना आसान बात नहीं होता है अगर आप वहां तक आ रहे हैं. Like just if you feel the word is that you have an example to it, right? So try to put it directly rather than trying to go for the specific term of it. Like procrastination is there, for which procrastination, which is postponing. So postponing is there already. So postponing everything for the next day is appropriate than procrastination, which is obviously procrastination is not here. So same way, there are certain symptoms which can be told in one word, but then it can be very well expressed in a very elaborate way. So always go for the meaning and according to it search. The other best thing that we can do is obviously Google it.
He's mentioned arbitrator is a person who solves all problems.
That is what,
again, like you said, the calcarea force was being neutral to.
That's what, like peacemaker, right?
Hmm.
Arbitrator is peacemaker, so go for peacemaker. And is it a pathology?
How far does a constitution, like if you're searching for a constitutional remedy, if you want to get into the person's constitution, how far does a repertory be the bridge for the materia medica when you're searching for a constitution? Like Mr. Sukla had just told, like a person who's an arbitrator or the person who wants peacemaking. So that again comes as a constitution part of the person. That is how the person is made. Every time he goes for some arbitrator's official persecution. Yeah.
There is one single remedy, Magmure, pacifist peacemaker, but that's not the only remedy. But like one who would like to stop discourse or why he is doing that is there. Like, but still that is not a pathology, so that may not be there. Why it is not also there is also because it has never been mentioned in materia medica, or it has never been mentioned in any case that could be entered over there. That's why it is not there. And then your question, constitution. What is a constitution? Like whatever traits that you want to put into in the form of symptoms is the constitution. What is, in fact, people say, sir, miasm. Miasm is also what you read Sora, afternoon aggravation, eating after one feels like sleepy, all those functional disturbances, irritability, dullness in the evening, all those things are there. Same way, syphilitic also has mental symptoms, physical symptoms, and all those things. If you are putting those symptoms into a repertory, or in fact materializing into a materia medica, conceptual picture, it is also covering the symptomatology of the constitution, symptomatology of the miasm. So repertory is not an alien, or it is not going to undermine anything. If it is covered, it has covered it. That's all. Only thing is that it's not mentioned. That's all. Symptoms are the same, right? Symptoms of a drug, symptoms
Yes.
of miasm, and symptoms of conceptualizing a constitution is also the same. Whether the person is lean, thin, or obese, or robust, muscular, or phlegmatic, or all those things. That is physical appearance of it. Then whatever pathology is that, you take it. And constitution is also like you take those physical generals, right? One who is habitually constipated or habitually thirstless. One who likes fan, dislikes fan, all those things. That's it. So that's like, see, arbitrator is an official person to solve dispute. So arbitrator at an official position, right? We don't have policemen in repertory. We don't have doctor in repertory because that's their profession, and we cannot put it under pathology or under good traits, right?
We have questions from our Facebook Live also. What is the rubric for knee effusion? Athi Ganga Naidu.
Adi Ganginaidu.
Adi Ganga Naidu.
Why is there any effusion? Because there is some inflammation, right? So one has to put swelling of the knee, and in that you can find it. That's what pleural effusion, knee effusion, and all those things. Swelling edematous knee is the one for pleural effusion. Okay. There are certain material medical words, but those may not directly reflect into repertory, but you have to understand the pathology or construction of it.
Sorry, doctor, for interrupting. Dr. Sukla wants to speak. Do you want to give access to him?
He's a female. Alpha.
Female, her.
Alpha,
I'm sorry. Can I just give access? I'm sorry.
yeah.
Yes, Dr. Sukla. I've given access.
Any patient has recurrent sodium levels less in old age. How to take the rubric 4 episodes 3 month? For these levels are not that actually mentioned in repertory as such. Some of the repertories they do have, but then low levels of sodium they do reflect some sort of symptoms, right? Those has to be considered. Those subjective objective symptoms has to be considered. If you can search for hyperkalemia, I think Roger Morrison has it, but it's not that reliable. Like, why is the sodium levels coming down is important rather than the frequency of sodium levels coming down. So causation is important, and the symptoms that are produced because of the hypo or hyperkalemia, like hiccups and all are present. So you can take those complex time modalities to it. That is how we work. So that's it.
Dr.
Like,
Sukla, can you hear us?
Yes, I can hear you.
Sorry, Dr. Sukla, yeah, tell me. Good evening. Hello? Doctor, we can't hear you. Hello? Dr. Sukla? Okay. Yes, doctor. Why complete repertory?
because it is complete.
Why? No, my question, maybe I should have constructed my question more. Yes, there is Kent repertory in the complete dynamics, but why complete? Like, there's always this pre-Kentian or pre-Kentian or modern repertory and pre-Kentian or post-Kentian repertory. That is, complete repertory falls under the modern repertory. So why not all the post-Kentian repertories?
Like the USP of what do you understand by complete repertory? Like, what is it made of?
A compilation, definitely a compilation.
Where is it compiled from?
All the other
All the old
Old
repertories.
repertory, yes, tower repertories.
Old, new, all repertories are there inside. If you don't know, there is a long bibliography of it, around about right now 3,000 sources, I think.
Yes,
Hello.
yes, Dr. Supriya.
Yeah. I'm sorry it got disconnected. My question was like, I have this patient and he said, I just love to do the work of arbitration. He's not an official arbitrator. So whether with it's in, like, if there's a fight in a family, not his own immediate family, but maybe some friends. So, people would come and ask to him to resolve. And maybe if it is in somebody's official matter or some legal matter, or may it be family or relationship, anywhere, you know he said, I just love to do that. People approach him out of the way, and he's not an official arbitrator as such, but that would be his disposition, isn't it? Because suppose if in the rubric we have cheerful as rubric, then since you said that is not a pathology, so even cheerful is also not a pathology. So then, how do we take it? I mean,
If you go, like, I can give remedy references. Cannabis indica is a very cheerful remedy, which is a pathological level. Like,
no, that is a different thing. This person isn't cheerful. I'm just correlating that, since you said to solve peacemaking is not a pathology, but then at the same time, cheerful is also not a pathology. So how we still have a rubric as cheerful? So that is a being cheerful is a healthy thing. You know, that is his disposition. So even this thing, solving people's problem or people approaching him to solve their problems. So why do we take that as like that it's not pathology or it's pathology?
yeah, cheerfulness individually has several remedies, but you can see the other things. Cheerfulness alternating with anxiety, dancing is there, and dullness is there, ill humor is there, several other things are there. And then
Hmm.
if you go further, cheerfulness only in a particular part of time. If you go through those drugs, the rest of the time they are dull or they are not in a mood. They get low after the high.
But there'll be a general rubric also, no? Cheerful.
सुनिए तो सही, आप मुझे बताने देते
Acha.
हैं.
Okay.
If in a disease condition, if cheerfulness is there, you can obviously take it. Cheerful, आप मेंसेस के टाइम पे cheerful है, बाकी समय नहीं है, तो एक अहमियत होता है, तो तब ले सकते हैं. क्योंकि मेंसेस के टाइम पे दुख होता है, दर्द होता है, वही पर्टिकुलर टाइम पे तो cheerful है. अगर most of the people they hate menses, like at least current today's girls and all. So if they are feeling cheerful at that time, they can be considered like cheerfulness perspiration is there. Like some of the good things can be morbidity too, right? There is ailments from overjoy is also there. Like a person who is very innervated, heart is very weak, or this. In those people, joy can create, even the happiness, slightest happiness can create a disturbance. So you can take it. What you are saying is that this person likes to be approached by people. So मैं अगर एकदम खड़ूस इंसान हूँ, मेरे को यहाँ पे कोई आर्बिट्रेटर नहीं बनाने वाला, या मेरे पास कोई कोई जो ये क्या बोलते हैं, सुलझने के लिए कुछ है ही नहीं. मेरे पास कोई आइडिया नहीं है, मेरे पास उतना ज्ञान नहीं है, मेरे पास कुछ क्या बोलते तरीका नहीं है, या संयम नहीं है, मुझ में पेशेंस नहीं है कि मैं किसी को बिठा के समझा पाऊँ, तो मेरे पास नहीं आने वाला है. तो इस इंसान के पास जो भी बहुत सारे और गुण हैं, जो विजडम है, वो सब के साथ वो सब हैं, इसलिए उसके पास जा रहे हैं. तो उसको खुशी महसूस हो रहा है, तो मुझे पेशेंट देखने में खुशी महसूस होता है. तो cheerful seeing the patient or being a doctor is not a pathology.
Is not a?
Being a doctor, do you think is a pathology? Or be trying to make people understand and trying them to bring to the calmer thing, or trying to please, do you think is it a pathology? Because I feel cheerful about it.
No.
तो आर्बिट्रेटर का भी वही बताना चाहता था। नहीं, मैं घुस के करूंगा अगर वो बोलता है, दूसरों को करने में मुझे मजा आता है अगर वो बोलते हैं, तब आप मजे की बात, खुशी की बात अलग होता है। मेरे पेशेंट को जा तू कूद इधर पे, ये कर वो कर, तू जो करना है कर, ये बोलना सही नहीं है। उसके साथ जो गलती हो रहा है उसको ठीक ठाक कर बोल रहे हैं। वाइफ एंड हस्बैंड आ रहे हैं, दोनों के बीच झगड़ा हो रहा है, तो आप ऐसा करेंगे तो इसके वजह से ऐसा कॉन्सिक्वेंस होगा और ये एलिमेंट्स होंगे, तो ऐसे डिजीज आएंगे, बता के उनको चुप कराना मुझे अच्छा लगता है। इसका मतलब ये नहीं कि वो बीमारी या कोई चीज में मैं कंसिडर करूँ, मेरे प्रोफेशन के हित में वो सही है। और एक इंसान के नाते भी दो लोगों के बीच में झगड़ा कम कर रहे हैं तो वो अच्छी बात होता है ना, उसमें खुशी ना हो तो तब कुछ कर सकते हैं।
So we do not take this as abnormal and disease.
मैं सबका चीज सबका बदल के सबका ठीक कर रहा हूँ। आई एम मेकिंग एवरीवन पीसफुल, आई एम रिजॉल्विंग द इश्यूज ऑफ एवरीबडी, बट आई डोंट फील एनी happiness or I don't feel any contention. I'm just doing it. People come, I do it. Then that is a pathology. Feeling good about something good that you do, not necessarily or definitely is not a pathology. If there is any wrong intention behind it, of course we can. Or I am like a patient is very sick, not even able to move. Even at that time, you want to be an arbitrator, you can definitely take those things. But why is he doing it again? That is the point. Does it like gives him a pleasure or?
Yeah, it's his pleasure. He likes doing it. He doesn't go out of the way, and people come to him. Like whenever they come, he helps.
People stop means he is not going to do anything, right? So that's done. If he wants to go voluntarily, then you can think of anything like that. It's not the thing.
So one more thing I wanted to ask you.
Yeah.
That there was this patient and his wife was saying that like kisko kuch in situations where people, anybody would react, he doesn't react. For example, she gave an example ke somebody had kept their car in our parking, and this person, the patient, he went and kept, because somebody's car was there in their parking, so he kept it in the garden. So what the building the other building people did, they in the WhatsApp group, they clicked the photo of that person's car in the garden and they put it in the group. So his wife was already saying that you just you click a photo and put it in the group, that see somebody else's car is in our place, then obviously where will I keep my car? So he said it doesn't matter, like I know who I am, and I did not explain them, I did not justify, and only if they come to me, then I'll tell them. But why should I prove that I'm right? And she said this is always there. He always doesn't want to go and justify and prove he is right, but how do we take this in form of rubric? And she gave me a couple of few more incidences where she said generally anybody would react, but he would be very cool. Doesn't matter, let him think whatever he thinks. I did not worry about it, So I thought it is something like content, or how would we take it in terms of repertory language, like.
What did you ask that patient? Did you ask why he does he?
He said, I don't want to prove. I asked him. He said, why? Because I know that I'm not wrong. I know that I have not made a mistake. Only if somebody will come to me, ring my bell, and then they would ask me, why did you park the car? But they have just put in the WhatsApp, so it doesn't matter. It doesn't make any difference to me. Only if they come and ask me, why did you do this? Then I'll say.
आपने जो एग्जाम्पल दिया है उसमें ऐसा है उनकी जगह पे किसी और ने रखा है, तो इट्स नॉट
उनकी जगह पर किसी और ने रखा था, तो बोले मेरे जगह पर जगह नहीं है मेरे प्लेस में, तो आई वेंट एंड केप्ट इट इन द गार्डन, लाइक द सोसाइटी गार्डन, लाइक ऐसा. So I felt personally that this is everybody would try to prove, because since it was put in the WhatsApp group, and apart from that, this person was a secretary of the building. So he said, I don't want to prove myself. It's fine.
He
People
doesn't,
know who I am.
he doesn't care for others. You can take haughty if you want to.
No, it's the same person I'm talking about, the one who solves others' problems.
Yeah, that's what. See, the same person, he solves others' problems, but then when but he want to come.
He said they didn't come and complain to me, no. Somebody would have come and told me personally, ठीक है अभी ग्रुप में डाल दिया तो डाल दिया, कोई बात नहीं. सबको पता है ना कि मैं कैसा हूँ, सब मुझे जानते हैं कि मैं कैसा हूँ.
वही बोल रहा हूँ ना, आप बोल रहे हैं जो भी whenever there is an issue, people come to him for all
Solution.
He is the troubleshooter, right? At the same time, there is an allegation against him. He says that let them come. So वो मुखिया बनना चाहते हैं और मुखिया हैं, मेरे पास आओ, मैं नहीं आऊंगा आपके पास. तो हॉटी ले सकते हैं, सिंपल.
But he is actually a very down to earth person. A very, very, very down to earth person.
That is the duality, right? He is down to earth. Down to earth means that reaching out to people and saying that this is what has happened. वो खुद बोलता है आने दो मेरे पास, और लोग भी मेरे पास आ रहे हैं, इसलिए मैं कर रहा हूँ, मैं खुद जाके नहीं कर रहा हूँ. I am waiting for people to come for advice. I am waiting for people to even to complain about me. So I am like, who is that person? A reckless person or a person who is not bothered about anybody? So in terms of that, what I would consider is haughtiness. Like मैं बड़ा हूँ, मेरे पास आ रहे हैं, अच्छाई के लिए भी आ रहे हैं, कोई कंप्लेंट है तो भी मेरे को सामने से नहीं बोले हैं, मुझे पूछो, कब जवाब दूंगा, मुझे क्यों बताना है, आने दो. It's very cool. Okay. Look, that is what is like. Person can be balanced at the same time. Person can be haughty. Just because someone is not showing the emotions or reacting doesn't mean that it is all fine. But that is what he is. He's trying to be the mukhya of the place. He's secretary, obviously. जो लोग आ रहे हैं सच में पूछताछ करने के लिए आ रहे हैं या मस्का पॉलिश लगाने के लिए आ रहे हैं, वो पता नहीं है ना. दो लोग बता रहे हैं, आप सुन रहे हैं. But
his wife also said, no, I know him. Like his wife also said, people come and approach him. Okay,
fine. You don't need to go. It's like deeds contradictory to action. Deeds contradictory to action can also be taken. That's it.
And so one more question, that what does this rubric objective reasonable mean?
You can go and read the Material Medica, I think. You will get the answers to it.
Okay. Thank you, sir.
Yeah, thank you.
Yes, doctor. I think we've taken a lot of time from you. Sorry?
Give me a couple of seconds. What she has asked is objective reasonable, right?
Yes, objective reasonable.
But you can see the what is to say, the cross references to it. So one is honesty. One who is honest, the one who has a rational idea to it, one who looks towards the right side of it. That is being reasonable at the same time objective. Trying to see a thing in objective, trying to be objective is what we say, the word that we use, right? Like trying to be bipartisan, like not to lean towards any right or left side and to be this one. And then if you are at a higher degree, injustice cannot support. Like, I know this is wrong, but then it is not my cup of tea. Why should I go and stop? Maybe he will come upon me. He's like, you know what is right, but you don't want to act upon it.
Being politically correct in a way.
And you know what is right and wrong, but you cannot act upon it. But at the same time, cannot support injustice is like, although it is not related to you, go and stand for it. Like, for example, there is a car that is going and someone has got rammed it, and the traffic is jammed or somewhere, and the actual one who did the mistake is shouting. So if someone is going in between and standing, it's like he is not supporting injustice. So that is like standing for a cause, right? It's not my job. Like saying it is not my job is different from someone has to ask is something. Like it is related to the moral. So being objectively reasonable is that. And you can see intellectual injustice cannot support. precision of mind increased. All those things are there. Like, that's why going deep into mind, if you can see actually this objective reasonable, there are old remedies, there are also new remedies to it. But to get a proper hold of it, like when I answered, it could have appeared like, oh, how could you say that you could have explained? But it was getting too late, so I just stopped over it. But then most of these come from cases. If you can see, I'm showing you. This is Elizabeth Hobart's case. Alumina is from Galavadian. And then this one, Samarium, is from Sholton, all these things. So most of them, it is conceptualized. So you will have to go and read the text again here to take it. In normal days, probably I won't take it, but rather I would take these things. Injustice cannot support, or being honest. Honest to the extent that it is going to hurt him. I am an honest person, but I will stand for my cause. I will not budge to it. Or I will diligently go and pay the dues, although there is a, what to say, there is an exemption, but still I would want to do all these things. Like the one who has good morals, good thinking, that we would see. Yeah, that's it.
That even straightforwardness could fall into that, being honest and sorry.
Another question, right? Why complete repertory? In the sense, you can use any repertory for that matter, but then when there is an ensemble of several sources,
Yes.
then all the other like you have Bonninghausen, you have Kent, but what is in Kent is not in Bonninghausen. What is in this is not. And usually, as I mentioned earlier itself, like one follows a different methodology and philosophy, and the other one follows a different
Philosophical background.
And the remedies in this might not be matching with that, because you see Kent, there are a fixed number of remedies. Bonninghausen again, they have a set of remedies. Some of them might not be present in both, but all those are present in complete repertory. And all the source material or everything from Kent is there, Bonninghausen is there, Allen's is there, Allen's Encyclopedia is there, Henning Guiding System is there, Nere is there, to the several journals like Homeopathic Recorder, all these things are there.
Yes.
Every proving is put into it, and all the cases that are available are put into it. So when it is put into it, you can obviously access all of them in one place in a combined format. Like it's not in Kentian this way. If you open BBCR, the first thing in larynx you see is larynx, and then there is time, aggravation, amelioration. You go in a particular format. Here it is in another format, but I would like to show how many types of rubrics are there actually. The components of any rubric will contain these things. It is like alternating states, that is the dynamism of sites, time, then comes modality, extension, location. Phenomena is any sensation. Information is just for this other sake, but that doesn't come under this. So you have these attributes, like the one attribute that is not there in Kent is also one attribute that is not in Kent and present in Bonninghausen is also there in complete repertory. Actually, complete repertory was first built upon Kent repertory as such. First Kent was added, and then other books were added. And then why I particularly use it, like I have been using it since years, and it was whenever I see it is accurate. So that's the one thing, the accuracy of it, and the easy to access. That is one thing. The speed of it. Like this is one case that I did with Materia Medica. Like this is the Bonninghausen's way of doing it. Yeah, so this probably I did it in 2014. So like it is constant learning, and although I am co-author to it, what I would suggest people is that don't concentrate too much upon mentals, like mentals that are not to be seen in repertory, or mentals that actually doesn't matter too much. What matters is like, see, when you are happy, or I am happy, or anybody is happy, when we are comfortable, when we have everything in the prosperity, the way we behave doesn't matter too much. But then when we are in a challenging situation or in a controversy, how we behave is what matters when in a conflict. Also, when there is an excess, also people like when they have too much to do, and when like there is lots of prosperity. Like one French queen said, right, when there is no bread to eat, she said that why can't people eat a cake? When you don't understand pain, also people can be wrong. So
Yes.
our reaction towards conflicting situations, anything that is causing pain, hurt, or discomfort, how do we react to it? Whether we are hostile, that makes it a symptom. Whether we are empathetic, that makes it normal. Whether we are too empathetic, that makes it, whether too sympathetic, that makes it again a pathology. Like we cannot go beyond our limitation and do certain things. Some people do it, that is being trying to be enterprising. So only things that matters are those, not these gray areas. Like what she mentioned is a gray area. You even like objective reasoning is like good thing. That's all. But the other two questions that she asked, that person who is a troubleshooter also is not going to, like he's trying to
Yes.
as being naughty. At the most, if anything wrong that we can see is naughty or intentions or not. Like he says that he's humble, person perceives it him as humble, but then he's not willing to give an explanation to what he did. Like he might feel that the other person has done wrong, he has to explain and all. But if at all he is such a troubleshooter, why would his own colony people again complain about him in the WhatsApp group? When I'm revered, people won't ask me, right? They will
Yes.
speak behind me. And I have read that, and I would say that they have not directly asked me, but I am also the member. They would obviously see whether I have seen or my relative has seen. People do it intentionally, right? So, who is the saint is also a question. That there is a gray area, right? So,
True. Gray area. Exactly.
considering
Sorry.
the not concentrating too much on the gray areas is something. In such cases, what is important is, as I said, we are not psychiatrists, right? We are not going to cure everything until unless they come for it. And with all cause, I think said that unless the patient is ready to get cured, you are not going to cure.
100%.
So those things are there. You know, we should not go to beyond a certain limits. So that's and then here this is my page, and see, if you can see, I have been repertorizing again and again and again almost every day at that point of time. So I'm still learning, I'm still repertorizing. That's what I do every day. So you can see here,
Yes.
this is a case. And, so on the side there is a description also. Reading a materia medica and trying to do it. And then this is named the remedy. In 2013 and all, there used to be quizzes. Even on your page, I love homeopathy, there would be small
Yes. Quizzes. Yes, I've noticed.
so we would answer it, those things. And like that's how the learning starts, right?
Definitely.
That is like, we don't know everything, we try to learn. So that's how we go about. And to make anything, for us to make anything better, we have to make sure that we use all the resources and go ahead with it, learn as much as possible. And one more thing is that brain has a limited capacity, right? We can't remember each and every rubric, and it also needs a mind frame to think and to answer. Like you have a patient beside you, I'm sitting on my consultation table, they present to you a scenario where you have to actually find a solution immediately, or you have to be spontaneous. Like you can have a patient who is an uneducated person, you have to educate him about what you want. There can be a very well educated person who has his own prejudice about homeopathy, who has doubts and confusions. You will have to again explain, doctor, tell me the name of it. If an educated person, right, asks and
Yes.
persuades, obviously the next thing they do is go and Google and ask. And they say, sir, I look into astrology because I want to make sure the things go right. But that doesn't mean that I am superstitious. Why have you given me this remedy? That superstitious is written. So how would you explain the person? Sir, that may be the case, but I didn't select it on the basis of your
So on the
use.
basis of the superstitious, that's true.
I only gave it for your physical complaints. It matches you. So that becomes a little difficult, right? And a person reads in some other this thing, and says that you have given me human shit, how dare you give me? Ball no sir. So that is there. Also, some educated people, they know that homeopathy asks several questions to you, and they are going to dig you deeper. No, I won't tell him anything. I'll sit like this only. There are people who would purposely do it. You will have to break their defense and get in. So for that, you have to be like, you have to have varying number of subjects wherein you unconsciously bring him out. Like if there is a tax consultant and he's doing like that, you go into detail, sir, how is the things going on, how is the tax system working, like we have to have some
Yes.
knowledge.
A path to break the ice.
So when we actually make him a little loose and he starts talking about his work and then goes further, at one point of the time or the other, he either supports a policy decisions or speaks against it, or he tries to showcase his excellence or his expertise over those things. Then you can go into it. It can be a software engineer trying to speak philosophy in front of him is not going to work. He might be like very materialistic about. You will have to catch the pulse of the patient, and you will have to say, and let us say the person has just come to test me. What else would you do? Like they might test. The person who comes to test you is going to fail. That is also there, right? So you shouldn't fail. And obviously, after a point of time, maybe you understand his intention. You give something. Or there are some people, they just make it for fun also. They'll come and I'll visit as long. Let me see how long it takes for him to crack my case. That is also possible. But like in city like Chennai, many people they already take homeopathy and then they come. So they also do it. So it's your duty to excel that person's personality at one point of the time or the other. Either you have to be very spontaneous, or you'll have to wait for the time to crack it. And some people, they themselves, some people, they find it astonishing that either by the patience or by the way we explain objectively, or some might even not believe that what you are explaining, like it happens with young homeopaths for that matter. You seem to be very young. I don't think so you would understand these matters and all. Many old ladies, they say, many old people, they say, because we get into the details of mind, right? You won't understand such things. They would all just deny
Yes.
it. But then how would you get into detail of it? Like you will have to have something to explain, right? So that spontaneity is needed. For that, only homeopathy is not going to help. You need to read things, understand. The actual point that I wanted to emphasize was to be successful in practice, you will have to understand human beings, how human beings react, how human beings think. A person, naive person may not know how others think, right? But being a homeopath, if you are naive, you're not going to do much, right? You will have to know everything, and it's not a homeopath's duty to judge. A homeopath's duty is only to see what is wrong, identify those things, put it and rectify those things.
Yes.
Not saints. At the same time, to maintain a rapport, we should also be in an empathetic way and give advice which they may or may not follow. Sometimes it can be in a polite way, sometimes in a very abrupt way, sometimes probably needs warning and shouting also. It depends upon the person, and homeopath should be in a position to change his roles according to the situation. That is what is going to help on the hindsight. So reading cases, what happens with cases that we read from books or from anybody else's narration is like a lot of information is left out. Even if I'm presenting a case, like we try to either try to present it in an objective way. Like I showed today's case, I just showed whatever the girl said. So that
Yes.
was me trying to do as objectively as possible. But I think probably everyone might have interpreted in their own way, right? So that is there, but it's not the same with everyone. Some people like, see, this was a thing, and I drew this from here and I put it here, like too philosophical. That may not work for everyone, but it might be interesting for someone else. But at the hindsight, a person who is 50-year-old is telling that I have a particular method of doing it and I did it like this and I correlated with this and I did this, is not going to match with the thinking of a 28-year-old or 25-year-old who has just passed out. So the simplest advice would be to just focus on what is wrong and what is to be cured. And with whatever knowledge you have for that age, understand how human beings react and what reactions are harmful, what reactions are hurting, or what reactions produce negative things, what reactions are positive. This much. There is no need to bang ahead on several things, like especially on mentals.
Very well said. I like you said, everyone talks on how to take a case or what is case taking or how to take a case, and I think no one has put it in very apt situation of what are the difficulties we face during a case taking. I think that is an entire session that we need to speak about on.
I hopefully will speak sometime about it.
Definitely. Doctor, people are asking for your email ID. Can we share your email ID or shall I?
Yeah, you can share my email address.
Yeah. Okay. I've shared doctor's email ID. Yeah. I think I'm
Yeah,
sorry. I've taken like over 2.5 hours of your time. Sorry.
no problem, no problem. I have no question. Dr. Alpa, I hope so you don't mind when I said that you go and refer the book. It was not in a rude way. I just told that probably that is the right place to refer for that rubric.
And we're curious. We dig deep into the literature.
Yeah, we are obviously, but it's a constant learning process, right? And
Yes.
one thing is that what we learn today, we feel like it is the right thing that we have learned. But when we read something else, we come to know that probably we were wrong. That is how learning is, right? It's constant process. Same way, one mistake that everyone does, even you asked for a little bit like constitution.
Yeah.
There is a bad thing that goes around with many people like, sir, am I laxis? Sir, your remedy na on the nature bureau, sir. The people come and
Yes.
ask, why should we brand ourselves in the remedy? And one thing,
Definitely.
even for a particular situation, we react in a particular way, and different paces of life are also there. And we get to, like in school, we are abused, okay, then we face certain things. But we try to cope with something, and we there is probably something, and then there is someone else who has guided us towards a better thing, and we are reacting in a particular way, and we have got certain complaints. The remedy obviously changes with, at least if not with the mental intervention, by physical ailments,
It does change.
and the steroid is given or a medicine is given, that changes, right? And then again further, some other homeopath has given a wrong remedy, and you done some other comes, your mind also changes.
Change.
Also with the age, we learn several things. If we are lucky, we get a person who is there actually to guide us without any wrong intentions. But people,
100%.
they guide us, but with a certain sort of intention also. So we travel in that direction. So it's a constant learning, and we do gain wisdom. So I don't think so constitution is going to be fixed. There can be basic traits, but then when you are normal, you don't need a remedy, right? When a pathology is coming, you will have to again check whether that is the remedy that is helping or not, and it
Yes.
will definitely change. So don't brand yourself like I am so and so, I am so and so animal, and I am so and so plant, I am so and so mineral. That is sort of an assumption. We just want to hear.
It becomes prejudiced again, judgmental.
Not only business, we just want to hear something good about us. Some people feel happy being a lachesis and and angry being a platino, or being what to say, calicarb. How dare you tell me that I am a calicarb? I am this remedy, that remedy. So people also want. See, it's human nature, right? We want to hear something good about us.
True.
Yeah, I am very delicate. That people want to say, but it's not about the pathology. Okay.
Definitely.
So, like if someone says that nitric acid seems to be very, what to say, the acids are most syphilitic and they are the achievers, someone said. And one fellow was skyrocketing, and his handwriting was not at all legible. He even told it seems the people with such handwritings on nitric acid, and they are greatest achievers. So he was skyrocketing, and probably he has not achieved what he could have achieved without knowing it, and he's still there. So someone gives you an idea that you are this and trying to catch it up. Like if someone says bad, what would someone say? Whether you would feel happy about it or you want to get rid of it. So everybody, I think so, wants to be a better person. So of course, some peoples might have taken the wrong direction. They can go further and further, but even with them, the remedy obviously changes. They may not be the same initially. So when the actual disease takes up, the remedy also changes. So,
Definitely it changes, yes.
that's my sincere advice to people, because many people who search for complete repertory always search for mind, but there is a lot beyond mind. See, I would like to show to people. There are so many sections, right? And they have lots
So
of
many sections.
and go through it. Mind is overrated. It is important. You do due diligence to it, and select only those symptoms that are useful. Otherwise,
Necessary, yes.
and one more thing is that if you say homeopathy is an art, and art can only be excelled after 50 years or 60 years of experience, or 10 years or 13 years of experience, what would a passed out do? And many people say, I have asked a question on Facebook, how would you excel art, especially when given that homeopathy is an art, that the people say it is also science, don't forget it. And
Thanks,
anybody
yes,
who has
definitely.
graduated has studied the science. So it should not make you feel low in confidence, like you have to follow this, you have to have failures, you have to do this thing. A doctor needs what, or any for that matter, any person needs is like dedication, patience, perseverance, understanding, learning, all these things. But also, one thing is there, along with practice and patience and trying to learn again and again, trying to better, one has to be little courageous to do things, or a risk taker to do things. Like you have opened up your clinic, anybody can come inside your clinic, and
Yes.
anything can happen to the patient within your premises. Like I had shared one case when a patient came in and I was confused whether he has a sunstroke or a heart attack, and he almost collapsed. I have put the video also, maybe people have seen. So when people what to say, uh, when he was inside, I was thinking, what would people outside my clinic think? My neighbors. He came walking and he's going on a stretcher, or he's dead. What would his relatives come and ask me? My only intention was to, like for that day, I was like, I want to send him walking. That's all. That was the only intention. So I cannot think at that time that whether I'm experienced or not, whether I'm an artist enough or not, or whatever. I'm a science student, I'm a doctor, and I should try to my abilities. And that's what probably I did. And he did go away walking. Then they went for the checkup. They saw the ECG changes, and he still thanks me. So this is also something that I wanted to convey,
Lovely.
although out of topic, but then since repetition is like art, I made use of it artistically. I do this in the sense when you're in compulsion, it guides you. And as I said, patient is the best teacher. Patient is in front of you and you have no other choice left. You will have to treat it by hook or crook. You search it and you will get it. He will take you to wherever it is needed. And the genius of homeopathy is that only physical symptoms also can guide you to an exact place when mentals are not there. Like one person asked, right, the patient is murmuring, not telling. But with this patient,
Yes, Anjali.
he was almost collapsing, not saying anything. Only gesture was this, and then I gave the I even represented, but initially cactus came. I gave, nothing happened. He was not improving, and then I searched, and then I gave pulsatilla. Pulsatilla is what made him better. So pulsatilla for a myocardial infarction, nobody can think. Same way, one patient with renal calculi, podophyllin was indicated. Like some other day, one fellow was coming, like I have pain in while sitting on my bike, and I have pain in my right scrotum, all this. He said, I just gave croton dig based on the symptoms, and the same evening he comes and says that I passed a stone in the unit, it came with so much of force. I didn't know that it was a renal colic, or it was those symptoms. So many people ask, how does this remedy work? You should not have doubts about homeopathy, number one. Number two, symptoms always guide you to a remedy. And there is nothing wrong in committing mistakes. Not knowing thing is not a sin, but not trying to know a thing is greatest sin. Yeah, that's it. Sorry if I taken long, but I wanted to convey all this.
Oh, we had a wonderful session. I think we've learned a lot today. Even repertory and apart from repertory also. So that is a success of a session.
I hope so people liked it, and thank you everyone
Yes.
for patiently
Thank you all for joining us today. It's been such a lovely session. I hope we continue to have more sessions like these with Dr. Rajesh. And please do join us for our future sessions. Thank you so much, Doctor. Have a wonderful
Thank you, everyone. Thank you very much
Thank you.
for my precious
Thank
time. I have done justice to the topic and probably whatever you expected from me. Thank you, and I once again you,
Okay.
Karthik sir, and all
Yes, definitely.
that have always joined and listened. Thank you.
Sure, sir. Sure, Doctor. Thank you so much, Doctor. Good night. Good
Good night.
night, everybody.